And welcome back to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, elder care planning, and the senior living industry.
And I'm Corrie Sirota, clinical social worker and author of Someone Died, Now What? Matt, how much do you actually know about prostate cancer?
Well, we've been fortunate to have some excellent guests over the years, Corrie, but what I can say, when I hear that, I hear encouragement. In a way, I would compare it to breast cancer, in that if we look back to 10, 15, 20 years ago and prognosis these days, there's hope, and it's still a very rough cancer, but things are improving, and even medical advancements like PSA testing, which we're going to hear about. Mm-hmm. So I would say hopeful, although very, very challenging for many families.
Well, then I think it's really important that we have this guest come on and clarify it even more.
Yeah, according to the Canadian Cancer Society, prostate cancer is the most common cancer among Canadian men, excluding non-melanoma skin cancers. It's the third leading cause of death still from cancer in men in Canada. In fact, 66 Canadian men will be diagnosed with prostate cancer every single day. And it's expected that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Still huge numbers. Prostate health is crucial. And to tell us more about it, very pleased to have John Warren on the line. John is the Vice President of the Prostate Cancer Support Group Montreal and West Island. And we also have Laurie Harrison. Laurie is a retired nurse, and she'll be giving the perspective of the partner or spouse, as Laurie's husband has had a prostate cancer. Welcome to Life Unrehearsed.
Hi. Hi, Matt. Hi, Laurie. Hi.
It's Laurie and Corrie. You're right. You're bang on.
It rhymes.
Yeah.
All right. It looks like we're having some challenges with getting Laurie on the line. We'll try to fix that up, or at the very least after our traffic update. So, John, you're going solo on this one, all right? And we'll try to get Laurie. All right. First of all, can you tell us about your experience with getting your diagnosis of prostate cancer?
Okay. Starting when I was I was 50, and I started going to a doctor's every year, my GP, whatever the doctor was, and getting an annual checkup and having a PSA, which is a blood test, and a digital rectal examination. So I was all right until, 2016, I tested, I was fine. And then the next year, 2017, I was diagnosed with prostate cancer, and it took me a little while to figure out what to do. Nowadays, it's the responsibility of the patient to decide, and it took me a few months to decide, and so eventually I had a prostatectomy in February of 2017. 16 I was diagnosed. 17 I had my prostate removed by surgery, robotic surgery. And then my PSA levels came back up again about a year and a half later, and then later I had what's commonly called hormone therapy, and I had radiation, 35 doses of radiation every weekday for 35 times. Yeah. So right now I'm okay.
Thank God.
Yeah. I mean, I myself, I don't think it's now, that was, I don't believe in this 5-year thing. I think that probably I'm one of these people that is living with cancer, and it probably will come back at some time. But I'm philosophical about it. I keep busy. I'm involved in this group. I'm involved as a guide at the Chateau Ramsay in Montreal. So my key to life is that I'm outgoing. I'm lucky that way. I'm an outgoing person. I'm social. Whoa. Are we still on?
I hear you. Hi.
We're still trying to get Laurie on the line.
Yeah, and I think we just lost John.
We did. We lost both. Poor Dan is First live show for Dan R. Opkin, and we'll get through it.
This is Life Unrehearsed after all.
That's right. We'll try to get John and we'll try to get Lori going. So what we're going to do is I was fortunate enough to talk to both John and Lori in a pre-interview, and they both. Lori is actually in Saskatchewan, and she's involved on a national basis for prostate cancer. That's how John and Lori ended up meeting each other. Lori's husband Boyd also had prostate cancer. And Lori is a real dynamo. I hope we can get her on the line because she's also speaking for the voice of spouses and partners. And we're going to talk to her a little bit about the importance of the role of spouse and partner. So, for example, I mentioned before, Corrie, the PSA tests. Men sometimes aren't the greatest with follow-up or even wanting to go to a doctor. And technology is so advanced, particularly with PSA tests, early detection, early diagnosis. And this is exactly what happened with both John and Boyd. It was PSA tests, but it was Lori saying, "Hey, come on, Boyd, get this done." And sure enough, both diagnosed. They ended up, and John talked a little bit about it in terms of treatments that were available. They both went the surgery route as well, called prostatectomy. There could also be radiation, and they're both doing quite well. And John was mentioning, I've had prostate cancer. I've had successful surgery, and the general public is, "Oh yeah, did you reach your 3-year mark or did you reach your 5-year mark?" We hear that, right? Yeah. And he says, "Matt, that does nothing for me because I still wake up every day wondering." And still it's in the back of my mind. So even though you may reach these thresholds or reaching these marks and your PSA levels are returning to normal, it is still worrisome for some people. And in John's case, this is what he mentioned.
I think that's a fair comment, though. I've heard it from other cancer survivors, call it, is that constant concern that no one talks about the post-remission feelings, reactions about every ache, every spot, every checkup, every blood test. What are you going to hear? So it's true to say, while there is markers around 3 years, 5 years, how many years, one can still find themselves. I think it's a more realistic. I mean, maybe one might say it's pessimistic. I think it's more realistic. Live your life, though. I guess it's pessimistic if you don't do anything and you're paralyzed. But if you allow yourself to live your life, given that you know how fragile it can be and how it can turn on a dime, then more power to you.
Yeah, such an important point. Live your life. It's okay to be concerned, and some are more anxious and how they cope with these types of things, but still live your life. You're listening to Life Unrehearsed with Matt and Corrie, and we're talking prostate health and prostate cancer.
Welcome back to Life Unrehearsed. I think we're all survivors right now. I'm Corrie Sirota with my co-host Matt Del Vecchio, and we're talking about prostate health with John Warren from the Prostate Cancer Support Group Montreal and West Island, and retired nurse Lori Harrison, whose husband has had prostate cancer. Lori, I understand you're on the line now, so I'm excited to talk to you. I want to hear everything, but we have only a limited amount of time. So I'd like you to please tell us about your husband, Boyd, when the diagnosis happened for prostate cancer, and also what your reaction was in the doctor's office when you were both given that news.
Well, those are pretty loaded questions. But first off, my husband was diagnosed with prostate cancer. It started the process of February of 2019 when he saw his GP. He went for his annual 5-year checkup. You notice, annual 5-year checkup. And his GP, just for shits and giggles, did a PSA testing. And she said, well, we'll do this and see what happens. So when we got back, we went on holidays and got back from holidays in April, and the doctor called him and said, "Hey, you better come in. Your PSA test is high. I want to do another repeat test, and then I also want to do a digital. Now, a digital exam is part of the process." The repeat PSA test showed that it was high again, and high is like Boyd's was 6'4" and 6'5" on the second return 3 months after. And she said, nope, we're going to send you off to a urologist. Saw the urologist. Urologist said, we're going to send you for a biopsy. Biopsy was done, and we went into the office to see the urologist, and he says, yep, you have cancer. And, of course, me being a retired nurse, I remember all the old crap, because as a nurse, you see a lot of the worst-case scenarios, right? And my thoughts were, well, okay, what do we have left for time? Not necessarily so. I'm getting all choked up talking about it here. But, and what's next step? Well, after that, he had to go see a radiation oncologist, and that appointment was at the end of June. My reaction when I first heard it, as you heard, is like, oh my God, is this the end or the beginning or what is it? Mm-hmm. And I just got up out of the chair after the office and I kept on walking out the door.
You're listening to Life Unrehearsed. That's the voice of Lori. She's actually in Saskatchewan talking about the diagnosis of her husband, Boyd. We also have John Warren on the line. John is the Vice President of Prostate Cancer Support Group, Montreal, West Island, and Montreal. Now, John, you might not have heard this just before traffic, so I'm going to ask you again. You brought something up earlier on when you've got the diagnosis, you've had surgery, had a prostatectomy, and things are looking good. You know, PSA levels are good. But you had mentioned also that it never really leaves your mind, does it?
No, that's true. And you really, I think people with any kind of cancer diagnosis, you can really, and it depends on your personality. I'm lucky, but I think you can go into really dark places, and I have an outgoing personality, so I keep busy, and I'm just as busy as when I was working as a welder. I'm just a 40-hour work week. So I think all of us have to figure out coping strategies on how to not go into those dark places, because I guess talking to other people that have had cancer diagnosis, now I go to the gym. I go to the gym 3 days a week and work out, and that helps my mental being. It sends off endorphins and all kinds of good things. And if you're not, I'm not a sports person, so it really helps.
Oh, absolutely. It makes sense what you're saying. Of course, it can be terrifying, but if do you control it, or what can you control within it is what you're doing, which is so incredible. At the same time, I want to reach out to Lori and say, well, Lori, what advice would you give other partners or spouses of someone who's been diagnosed with prostate cancer?
What advice?
Yeah.
Well, first off, when you mentioned Boyd had prostate cancer, no, Boyd has prostate cancer, and that's a diagnosis that you learn to live with. And the advice that I would give people, first off, as a partner to someone, because it is a partner's disease, it affects both of you, husband and spouse, and or husband and spouse. Yes, that's correct. And when you're diagnosed with it, no two persons are the same. One treatment doesn't work for one person, and it may not work for the other. And it's very early for an early diagnosis. And with Boyd's situation, this was very important. He had his early diagnosis. It led him to an option of different types of treatment. And one could have been brachytherapy, which is radiation therapy, but he felt that wasn't his option because he has other health issues with his bowels. So he went with surgery. And the important piece here is what they're finding with people with this is you have to go through step by step by step. That being, you go for your PSA testing, you have to have a digital exam, biopsy, and then you look at your treatments, and you look at also bone scans and also abdominal CT scans to see in stage and know where this cancer is going.
And as a retired nurse, Laurie, and as a spouse and a partner, you play such an important role in this whole process, even though Boyd's going through it. You're listening to Life Unrehearsed. Matt and Corrie here, and we're talking with John Warren from the Prostate Cancer Support Group Montreal and West Island, and retired nurse Laurie Harrison, whose husband has a prostate cancer, as she has said. We're quickly running out of time here, but I want to make sure we get a shout out to organizations that you are involved with. John, very quickly, tell us about the Prostate Cancer Support Group that you're involved with.
Okay. We've been around for over 25 years. We started off serving the West Island, and then we added Montreal to our name, but really, in a sense, we're serving the rest of Quebec, actually, the Anglophone community of Quebec, because we're the only English-speaking group in Quebec, support group. So we have a 24-hour helpline. You can leave a message there. We can get back to you, and you can get that phone number if you Google Prostate Cancer Support Group Montreal, West Island, or something like that, and you'll quickly get to our website and get our phone number.
It's all there.
Okay, perfect. Now, Laurie, I know you're in Saskatchewan. I know there's some very valuable national resources out there. So,
yes,
you want to talk about
true.
some?
And actually, John and I are both part of the Prostate Cancer Support Canadian group. And as John pointed out, the website. But also there's a toll-free number that they can access as well, and that's 1-877-840-9173, and that will lead them to more information, and they can access that, and all the best to them.
All right, Laurie and John, thank you so much for helping us out here and understanding a little bit more about prostate cancer. We want to thank you for joining us on Life Unrehearsed.
No problem. Glad to be here.
Yes, thank you very much.
Thank you, John Warren from the Prostate Cancer Support Group Montreal, West Island and Montreal, and Laurie Harrison, retired nurse, calling from Saskatchewan in supporting her husband, Boyd. All right. Corrie, what do we have coming up next week?
Next week on Life Unrehearsed, autoimmune diseases are more prevalent than you would think. We're going to hear from a young woman's journey in battling a rare autoimmune skin disease, and in recognition of Breast Cancer Awareness Month, we'll be interviewing the founder of Empower Inc., organizing mastectomy tattoos so that women can feel beautiful on their own terms.
Yeah, can't wait for that. She's had some excellent media exposure on these mastectomy tattoos. Something else. Hope you could join us. And thank you for tuning in to Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. You can call me at Lianas Senior Transition Support at 514-622-8074, or make it nice and easy, just look us up at Lianas Senior Transition Support. Many thanks to our technical producer, Dan. You did it. Your first live show.
Congratulations.
And you can listen to Life Unrehearsed here on CJAD 800 every Saturday at 3 p.m.